Techniques for self-breast exam. This is Dr. Alison Laws. She is a new surgeon who's just joined our faculty here at the Brigham and also cares for patients in the breast center and the BPREP program. So thank you, Alison.
Hi, everybody. Thanks for having me. Nancy, thank you for that wonderful session. I got up and did some exercise with you, and I was happy that the aerobic component was largely at the beginning so that my heart rate and shortness of breath has had a little bit of chance to recover before my talk here. I'm going to be speaking a little bit about self-breast exams today. I think that this is definitely can be an intimidating endeavor for women, but I think that self-breast exams are well within all of your capabilities. And so today we're going to talk a little bit about the who, what, when, where, why, and how. And I hope that I'll leave you feeling a little bit more confident and with some strategies to be able to implement this as part of your routine. So we'll start with the what. What is a self-breast exam and what am I looking for? The self-breast exam is a check of how your breasts look and feel that you perform with your own eyes and hands. There are a variety of things that you might find on your self-breast exam. I think it's helpful to have a bit of an idea of what types of abnormalities you might be looking for. So when we're doing the feeling part of the exam, where we're feeling the breast and the armpit, primarily we're looking for lumps in the breast or the underarm. There's also a significant component of the self-breast exam that involves looking at the breasts. And when we're doing the visual inspection part of the exam, we're looking for things like change in the shape or size of one of the breasts. Sometimes you can see swelling of a breast. We might see changes to the nipple or the areola. So that can be things like an inverted nipple, just shown in the middle figure there, where the nipple's a little bit pulled in. You can sometimes see discharge or fluid leaking from the nipple. Or you may see a rash in that area. And then finally, we're looking for skin changes elsewhere on the breast. And so this can involve things like a little dimpling or divot in the breast, which you can see in the bottom image here on this slide. You might see a rash on the breast, or you might see a little bit of a bulge of the skin, and that might be associated with a lump that you can feel. All right, so why should I perform a self-breast exam? What's the purpose? Well, we know that a small proportion of breast cancers are not visible on screening mammograms. This isn't common, but it is a minority of cancers that present this way. And so the way that we typically detect these is by changes in the clinical breast exam. If you're performing regular self-breast exams, it really helps you to improve awareness about your breasts. You can become familiar with what the normal look and feel of your breast is. And this way, if there are changes that come up, you'll be able to more promptly identify these and bring them to the attention of your medical provider. Who should be doing self-breast exams? This is a pretty easy answer. Really, we encourage all adult women to be performing regular self-exams. So there's no particular age criteria that we think about, regardless of whether you have a family history of breast cancer or not. Really, remember, the purpose is to become aware of what's sort of normal for you. And so the more regularly you do this and the earlier you start this in your life, you're going to have a lot of data over time to know, okay, this is just normal for me, and really can help you identify when these changes do come up. When should I perform my self-breast exam? So typically we recommend a self-breast exam be performed once per month. If you are a premenopausal woman, which means that you're still having periods, then we recommend that you perform your self-breast exam the week after your period ends. And timing the breast exam with your cycle is done because there are some little lumps and bumps that are benign that can come up close to the time of your period. And that's a result of the hormonal fluctuations that happen during that particular phase of your cycle. And so we recommend you perform your exam the week after your period ends, because that's when the breasts tend to be sort of the least active from a hormonal perspective. And then if you're postmenopausal, so you're not having periods anymore, then I recommend that you just choose the same day once per month, so that it becomes routine and something that you remember to do. All right, so now we'll get into some of the details about, where am I performing this exam and how am I doing it? So like I alluded to earlier, the first step of the exam, and a very important part, is actually a visual inspection of the breasts. So I recommend that you do this, in the privacy of your bathroom or your bedroom, facing a mirror. And you want to look at the whole chest wall, the breasts, and you want to look in different positions. So I usually recommend you start with your arms relaxed at the sides, then you bring your hands up to the hips, and then you raise the arms above the head. If you have a larger breast, you may even need to use your hand to lift the breast and make sure that you're really looking at the under area of the breast as well. And this is the part of exam where you're looking for all of those visual changes that I talked about on the skin, the shape, the size, and the nipple areola area. So then after you've thoroughly visually inspected the breast, I then recommend that you move on to the portion of the exam where you're going to palpate or feel the breast and the armpit area. If let's say you're starting with the left breast, you're going to use your right hand to do this. And I think the most thorough way is to actually do this in 2 positions. So first is with you standing upright. So after you've been in that position, looking, visually inspecting in the mirror, you can then palpate the breast in that upright position, again, using the opposite hand. And then, as you know, what we do as physicians and in the clinic, you see that we examine you lying on your back. And so this is an important part of the exam as well. So you want to lie down comfortably on your back, either on your bed or on the floor. If you're, again, examining the left breast, you're going to bring the left arm above the head and then use your right hand to examine the whole breast and armpit area. And then you're going to repeat this on the other side. So I'll give you a little bit more sort of the tips and techniques component here in terms of when you're feeling the breast, what are some ways that you can do this to kind of maximize the efficiency of the exam. So the first piece is that you really want to be using the pads of your fingers. So I usually recommend you kind of hold your fingers so that you're using the pads of the 2nd, 3rd, and 4th finger. You're making a flat surface and you're examining systematically using that surface of the hand. If you use the fingertips, kind of 2 things can happen. Sometimes you can miss things because you're not examining as much surface area at one point in time. Also, sometimes you can pick up little ridges that are just sort of part of the normal breast tissue with the fingertips, whereas if you felt with the pads of your hand, that would all just sort of feel like a flat area. So it can kind of help, it can cause confusion in both directions using the fingertips, and really the pads of the fingers is the better way to do things. The other thing that is important to know about, particularly if you have a larger breast, is that using different levels of pressure will help you to better feel different depths of the breast. So that there's an image here that kind of demonstrates that when you're feeling with a lighter touch or more superficial pressure, you're going to better feel the superficial tissues in the breast. So those are the pieces of the breast that are closer to the skin. Whereas if you then, convert to using a little bit firmer pressure, that's when you're going to better feel the deeper areas of the breast closer to the chest wall. So I do recommend that in any given area that you're feeling, you start with a little bit of a lighter pressure and then a little bit more firm pressure to make sure you're really feeling through the depth of the breast. We also, kind of as an extension of that, want to make sure that we're being systematic in terms of covering the whole surface area of the breast and the armpit. The breast tissue itself can actually extend quite high up into the armpit. This is called the tail of the breast. And in addition, in the armpit, there are some lymph nodes that live in that area that drain the breast and that can sometimes become firm or enlarged if there's something going on in the breast. And so you really want to make sure that you're including the armpit area as part of your exam for those 2 reasons. We also want to make sure that we have, whatever approach you're using, some kind of systematic approach to make sure you're covering the whole surface area of the breast itself. And I've shown, there's a nice image here that shows 3 different examples of ways that you can do this. No one is right or wrong or better than the other. The key is just that we want to make sure that we're touching all areas of the breast and not missing any parts. So the swirl pattern or circular pattern involves starting at the nipple and then using sort of concentric circles that move further and further out from the nipple areolar complex. And you go in these kind of consistent circles to ultimately cover the whole breast. There's also the straight up and down, or the way I was taught in medical school is the train tracks method. So that's in the middle image there. you're going to start, I would recommend that you start at the very midline of the chest, the breastbone. And you can start at the upper part of the breast. You're going to work your way all the way down in a straight line, then move slightly over and work your way all the way up in a straight line. Move slightly over and all the way down until you've covered the whole component of the breast. The final way is the compass method, or spokes on a wheel is the other way you might see this described. This again involves starting at the level of the nipple and then working your way out in straight lines, kind of along the spokes of a wheel or around the compass until you've covered the entirety of the breast. The last piece that I'll say that's kind of related to all this is that I really encourage you to take your time. A breast exam is not something that can be done in 30 seconds or a minute. This is probably going to take you 5 to 10 minutes to complete. And so just take your time and pick a system that works well for you and that you can kind of remember to consistently do every time. The last thing that I'll cover is just, what should I do if I find something? We always try to reassure you to don't panic. There's lots of lumps or lesions that can present in the breast that aren't cancer. Again, for women who are premenopausal, so if you're still getting your periods and if you happen to have felt something close to when your period is starting, then I usually recommend that you wait 2 to 3 weeks until you're kind of into a different phase of your menstrual cycle and see if the lump that you found persists. And if it is still persistent, or if you're a postmenopausal woman, you're not having periods and you felt something, then I recommend at that point you contact your doctor and schedule a visit. It's important to remember that if you ever find something on your self-breast exam, even if you've had a recent mammogram or if you're getting breast MRIs, any breast imaging that you've had recently, even if it was normal and you found something unusual or new on your self-breast exam, I definitely want you to seek attention because of that piece that we talked about, where there are small times where imaging can miss things. And so your clinical breast exam is certainly an important part of working up anything new that's come up.